Health insurance is the only product you pay for hoping you never use it, and the second you actually need it, you find out the rules were never written for you. You pay every month. The premium goes up every year. You're told it's protection, but when the bill arrives, the deductible is higher than your savings, the copay is higher than your rent, and the procedure your doctor ordered suddenly needs approval from a stranger in an office 1,000 miles away. That stranger has never seen your chart. They have a quota, and the quota isn't to help you. Here's the part nobody explains to you up front. Health insurance was never designed to pay for your healthcare. It was designed to sit between you and your doctor, take a cut from both sides, and decide who gets what. Your doctor sends a bill, the insurer slashes it in half. The hospital, knowing this would happen, doubled the bill before sending it. You're not paying for medicine, you're paying for a negotiation you weren't invited to. But that's not even the worst part, because the hospital and the insurer aren't enemies, they're partners. They need each other. The insurer needs the hospital to charge insane prices, because if a stitch costs $12 instead of $1,200, nobody would buy insurance. You'd just pay cash. So the insurer wants prices high, and the hospital wants prices high too, because the higher the list price, the bigger the discount the insurer can wave around to justify your premium. It's theatre, and you bought the ticket. Now you're probably thinking, okay, but at least if something catastrophic happens, I'm covered. That's the deal, that's the trade. Except here's what they don't put on the brochure. The number one cause of personal bankruptcy in this country is not gambling, not divorce, not bad investments, it's medical bills. And the majority of people who go bankrupt from medical bills had insurance. Read that again. They were paying every month, on time, and when the worst day of their life arrived, the policy they trusted handed them a bill that ended them anyway. So what are you actually buying? You're buying access to a network. That's it. You're buying permission to walk into certain buildings and see certain doctors at a slightly less insane price than the uninsured guy standing next to you. The insurance company isn't a safety net. It's a toll booth between you and a system that decided decades ago that your body is a recurring revenue stream, and the deeper truth is uglier than the surface. The system isn't broken. It's working exactly the way it was built to work. Every confusing form, every denied claim, every out-of-network surprise, every pre-authorization phone call that swallows 4 hours of your life, none of that is a bug. That is the product. Friction is the product, because every claim they delay is interest sitting in their account. Every claim they deny is profit on their books. Every patient who gives up and pays cash is a win for everyone except the patient. You were taught to think of insurance as a deal between you and the company, but the deal isn't with you. The deal is between the company and the hospital and the pharmaceutical lobby and the regulator who used to work for the insurer and will work there again next year. You're not in the room. You were never in the room. You just signed the bill on the way out. So the next time someone asks you why healthcare in this country costs more than a mortgage, don't blame the doctors. The doctors are drowning too. Don't blame the nurses. They're working doubles to keep the lights on for you. It's not even the hospitals, not really. It's the layer in between, the layer that heals nothing, builds nothing, cures nothing, and takes a cut of everything. You don't have health insurance, you have a subscription to someone else's profit, and every month, without reading the fine print, you renew it.